Hi, and welcome to another scoliosis research review. I'm David Butler, and welcome to my clinic, Align Therapy. These research reviews I go through to discuss current research that has come out recently and research that influences how we practice scoliosis-specific treatment. And so if we're doing a research review, it's because it's a topic and a research article that seems to be something that might change the way we do things, or explains why we do things, or supports what we do. So this research review is an article that came out recently in February of 2024, and it's titled "Effect of Traditional Rehabilitation Program versus Telerehabilitation in Adolescents with Idiopathic Scoliosis During the COVID-19 Pandemic, a Cohort Study." So what really brought my attention, or took my attention with this, was the emphasis on telerehabilitation. So telehealth is something that we played around with as well during COVID-19, and it was really the only thing we could do during that time for some of our patients. We never actually closed the clinic, but we started to play around with using telehealth to get treatment to people who were stuck in their homes and things like that. So it's really interesting to see a study that looked at that specifically. I get asked all the time whether or not we do telehealth. We get asked from other countries, other states, places where they don't have Schroth method therapists that are treating. So it was really interesting to see that a study actually looked into this. So the study looked at 66 subjects, 66 patients, split into two groups, 33 patients each group, and it looked at the difference between traditional treatment and telerehab treatment. The one thing that was interesting in this study, it didn't look like they were doing specifically Schroth method exercises or a specific method of scoliosis specific exercise like the C's approach or the Lion method or something like that. It looked like it kind of combined a few different exercises. So they looked at in-clinic treatment versus telehealth treatment, and all of these patients had curves that were between 30 and 45 degrees, which are significant curves. And a lot of times I see that surgeons specifically will not refer as they get closer to 45 degrees, and sometimes won't even brace because they feel like, I think it's almost a lost cause, where they're going to do surgery anyway. So this is a really good group that has shown progression, and they will most likely progress. In this study, they quoted another study that showed a progression of 5.4 to 9.6 degrees over 6 months. So they're progressive curves, and so they split those 66 patients into 33 that were at home and 33 in the clinic. So the interesting thing was that they saw both groups had a reduction in their Cobb angle of their main curve. The traditional group had a 4.9 degree change favorably, or in a positive direction, and the telehealth group had a 2.4 degree change with a reduction in their scoliosis curve. So that's over 6 months. So that's pretty good. Both ways of treating, both at home with telehealth and with traditional treatment, yielded good results. So the traditional group had a more significant reduction in their Cobb angle of their main curve, but there wasn't a huge difference between the two. So to me, that's really encouraging. When we do telehealth, I sometimes wonder if there's a significant benefit. I wonder if I'm doing a disservice with not doing traditional therapy in the clinic. The fact is, some patients can't make it to the clinic. A lot of people don't have access to healthcare professionals that know what they're doing with scoliosis. So is telehealth better than nothing? And it probably is. And I think we can use telehealth better than we have been for treating scoliosis. It's interesting, in the study they also measured a couple other things. They measured what's called Nash and Moe, which is the rotation of the spine, looking at the pedicles of the spine, and the results showed that there wasn't a significant difference between the traditional group and in the telehealth group. They looked at the Cobb angle of not the main curve, but the secondary curve, and there wasn't a significant difference between the traditional and the telehealth group with that either. So I think it's something worth exploring with telehealth. A lot of times I think, scoliosis treatment is better in person in the clinic, where we can see in 3 dimensions and we can really get our hands on people and help them to learn the exercises. And this study did show that that is true, but I think there's something to telehealth. If someone's committed and you have the right program and you have someone who's specialized and knows what they're doing with scoliosis specific exercise. So a very interesting study to me. I think in the future we're going to have something telehealth wise or online program wise or something like that can help people who don't have access to scoliosis specific treatment to come and interact with us and really get something rather than nothing. So really cool. I hope more studies like this come out and they show that we are still seeing benefits even though we're working remotely with people. A couple of things, a weakness of this study is that it didn't have a control group. Its control group was traditional in-person therapy, but it didn't have a control group that was 33 patients who weren't treated at all and were followed to see what their curve did. And some of that may be because they didn't feel like it was ethical for people to go without treatment, but I think further studies need to be done on whether telehealth can really be something that we do and is really helpful. But it's promising, and I still think it's most important and most beneficial to be seen in person. There's just some things we can do in person that we can't do in telehealth, but this is promising. And as technology gets better, who knows, maybe we'll have other ways that we can treat in 3 dimensions with, who knows, virtual reality or something like that. So stay tuned. We'll be going over other research articles as they come out. Hopefully this was helpful, and hopefully it gives, if you're someone who lives in an area that doesn't have scoliosis specific professionals, hopefully this gives you a little bit of hope that in the future we will have something like that. And stay tuned because we're working on something like that. So thanks for watching. Don't forget to subscribe to the channel so you can see as we progress with our ideas on online learning and stuff like that. So thanks for watching. We'll see you next time.